Hey guys, I am running a few minutes late. I apologize for this, but today I want to talk to you about an amazing program and opportunity. I'm going to take off my glasses because there's a glare and it's bugging me. Amazing opportunity. So, the first thing I want to ask you is raise your hand if you or anyone you know either has extremely high deductibles, high copays for their insurance, or if you know anybody who is uninsured. So, have you or anyone that you know experienced not being able to go to the doctor or not being able to get your prescriptions filled because you didn't have the money to do that? Raise your hand. I'm raising my hand because that has definitely been a situation that I have encountered in my lifetime. So it would be highly unusual if you didn't know someone or if you hadn't experienced it yourself where you were unable to get the care that you needed. So, if you don't know me, hi, I'm Liz. I am a retired registered nurse of 28 years. I am very holistically minded. If I could wave a magic wand and make every single person watching this video stock up on things like colloidal silver and tinctures and herbal medicine and essential oils and do things like ferment your garlic and in honey and take that every single day through the winter months and also make some fire cider and take that. If I could force every single person to do preventative health measures and do those things, I absolutely would. But the truth is, I can't force anybody to do anything, right? So, will those things help your overall health? Absolutely. Freaking yes, they will. But there is a time and a place when we all come to some time that we need to see a physician, right? We need urgent care. And if you're anything like me, you don't want to actually have to go to an urgent care. I don't. Because guess what? When you are sick or your kids are sick and you pack them up and you go to an urgent care, guess who else is there? People with other sicknesses. And guess what? In 7 to 10 days, not only are you dealing with recovering from whatever you went to the urgent care from, you're likely now maybe having symptoms of something else that you got exposed to there. Like if you went for a cold or flu or sore throat, now you've got the poops and the vomits. I mean, so that's what happens is even if they clean, even if you mask, even if you do all the things, when you go to a doctor's office or an urgent care, you're getting exposed to other stuff. And if you're anything like me, I don't know, maybe you're just a little opposed to even going into the doctor because I just don't like going to the doctor. I don't like it. So I have found a solution that I want to share with you. And the solution is um, telehealth. So I found a program where you can get, when you become a member of this program, you can have free, unlimited urgent care telehealth visits, and get free or deeply discounted medications if needed through that telehealth visit. Okay. So if you're watching on TikTok and or YouTube, hello. If you're watching on Facebook, please say hello. I'm probably not going to be able to see Facebook comments, unfortunately. But if you ask me a question on Facebook or if you see it, what was I going to say? Anyway, I will come back and I will answer questions on Facebook and on YouTube. On TikTok, I can see your messages. StreamYard, I'm using to stream at the same. Anyway, I can't see messages a lot of times. So hopefully if I'll be able to catch up with those. Golly, Liz, fumble through it. Okay, so what I'm going to do is I am going to go through the short and sweet overview of the programs, what they cover, what they don't cover, and all of that good stuff. Very short and sweet. But if at any point you want more information about it, just type the word link in the comments and I will get the information to you. If you want to join our information group, you could type the word group in the comments and I will get that to you. If you're on TikTok, typing those in the comments will not do any good. You'll have to go to the link in my profile and those links are already there. So you're just going to click on that photo of me up in the corner, go to my profile, and all the links that you need are right there. Okay. Okay. So what is this program? So it is a healthcare membership program. I'm sorry, but my notes are falling. So that's what happens when you go live. You just got to wing it. So it's a healthcare membership program. It is not, I'm just going to hold them. It's a healthcare membership program. It is not health insurance. It is not health sharing. It's just a addition. So you don't have to get approved for it or anything like that. It is a telehealth only program. That means it is virtual visits, meaning you either request a video call or you request a phone call. So I had a friend of mine that joined this morning, and immediately she joined because she was having a health issue that she wanted to talk to somebody about. So she joined, she put in a request for a visit through her portal, and 10 minutes later, I'm actually going to be posting that testimonial as soon as my screenshot from my phone. I'm going to be posting it on my Facebook stories, and I already posted it on my TikTok. Within 10 minutes, she was on the phone with a doctor and her prescription had been called in. Very first day she joined the program, she already used it. She already had a prescription called in. I had that same exact experience. So whenever I joined last week, I wanted to test it out and I was having a problem with my ear. So what I did was I went in, filled in my patient information in the portal. I requested a visit. For me, it took 20 minutes. And I was on a video call with the doctor in 20 minutes, and my prescription was called in and I was done. All from the comfort of my home, all completely telehealth done. It's just simply that simple. So this is perfect for someone who is either uninsured or has an insurance plan like we have with an extremely high deductible and a high copay, because who wants to pay $300 for an urgent care visit? Not me. So this works really great for people like myself. Another extremely wonderful perk of this program that I absolutely adore is that once you sign up for the program, then you can add 7 people onto your plan. And they can be friends, they can be family, they can be neighbors, whatever. So let's say you have a neighbor who is a single mom and her kids are covered by Medicaid, or maybe they're covered by the dad's insurance, but she's uncovered. She has no insurance. She has no nothing. You can show her some love, and you can put her onto your program. All of it's going to be HIPAA approved. So like she would get her own portal, she would get her own login, and she would get all of her own stuff, but she gets those prescription benefits and she gets those urgent care benefits all under your umbrella of your plan. So let's talk about what's included very quickly. Again, if you have questions, I will answer questions at the very end. If you're on Facebook and I don't see your messages, then or your questions, I will type an answer to those questions after the video is over. Okay. Because I'm seeing YouTube. Hey, I'm seeing YouTube comments, but I'm not seeing any Facebook comments on here. So okay, so let me talk very quickly, and I'm going to answer some frequently asked questions at the end too that I've been getting from people. Okay, but let me answer. Let me tell you exactly what's covered in these plans. If you want a very detailed description, it's in the Facebook group that I have. So again, if you're on TikTok, then hop over to the link in my profile. The group link is there, and the link to get more information is there also. If you're on Facebook, you just need to type the word group or type the word link if you want either one of those things. We have to play the little games on Facebook, because if I include the links in my comments, nobody's going to see any of it. Okay. So the dealio is there's a basic plan. That's what a lot of people do, is the basic plan. The basic plan is urgent care visit, unlimited number of urgent care visits, and 24 hours a day, 7 days a week, and free or discounted meds. That's all for up to 8 people total for $30 a month. Not $30 a person, $30 total. So one person pays $30 a month, and then you can add up to 7 people to that plan. Okay, so that's $30 a month. Somebody give me some feedback. Is that not a wow? That's a total wow for me. $30 a month, and you can add 7 friends or family. Come on now. Free Unlimited number. Like my friend today used an urgent care visit within a few minutes of joining. I did the exact same thing last Saturday. It's just that simple. Okay. Then there is a middle plan. It is $60 a month, and it includes all those the urgent care and the prescription plan. And added on to the $60 a month are mental health counseling visits. So virtual mental. This is a big one, guys. Have you priced how much it costs to go to one therapy session? In my area, it's around $200. So you get that as part of your $60 for 8 people. 8 people have that benefit now. And if you are prescribed medication due to that visit, you get 90-day supply of mental health medications. So if you're on antidepressants, you already have a prescription for those. If you're on a medication for that, antidepressants, anti-anxiety medicine, any mental health medication, 90-day supply for free. For free. Okay. And then there is what they call the platinum program, which is their highest tier program. It's $90 a month, but you get all of those benefits that I already mentioned. Plus you get a virtual primary care physician who can order lab work for you, annual lab work, and can order lab work for other anything else you want them to order at a discount. They work with many labs, and so you get that. So the virtual primary care visits are $25 per visit. You get chronic medications, a free 90-day supply for the chronic meds. And for people like have high blood pressure, diabetes, any kind of medications that you take each and every day, 90-day supply for free. So I'm going to take a brief little pause because I know people are going to be asking me, is this medication covered? Is that medication covered? I have a link to a database where you can type in the medication to see if it's covered under our prescription program. And that link is in the Facebook group. So again, you need to join that group because that's where all the resources are. That way I don't have to send out all these different links and messages to people all day long. It's more efficient for me to have it all in one place in that Facebook group. So again, if you want in that group, you're just going to type the word group if you're on Facebook. If you are on YouTube or you are on TikTok, that link is going to be in my profile on TikTok. And if you're on YouTube, you're going to have to private message me and I'm going to have to message you back, or you're going to have to find me on Facebook and it's all there. Okay. So I'm not finished yet. For that 90 days, you get the virtual primary care, you get your chronic meds. If you're diabetes, you get a diabetes kit, which includes your glucometer and all your glucose supplies. Also, for the 90-day fee, you get a men's health visit. If you have a man in your life and he has ED or he has low testosterone or he's having hair loss, those kind of visits are free. You get 3. This was a big one for me and my family. You get 3 dermatology visits a year because, come on now, I am 51 years old. Why am I still getting zits? Why? Probably hormones. But anyway, if I wanted to see a dermatologist virtually, I can do that within my plan. And I already mentioned this, but yes, you do get free annual blood work and discounted labs through. What this is a virtual program. So there are no in-person visits. So there's no dental care. There's no vision care. You do not get to go into an office to see a doctor. This is all 100% virtual. There is a pet plan. If you have pets, it's $20 a month. They do not diagnose or treat in that plan. It's just an advice. So if you want advice from somebody, a pet tech or a pet person, it's not going to be a veterinarian. It's not going to get diagnosed or treat. So anyway, there's that. And there is a fit plan that is coming. I know this is a lot, right? But there is a fit plan that's coming for anyone who wants to be on Ozempic or whatever, that kind of stuff. That is coming. We don't have it yet, but it is coming. Okay, where are the frequently asked questions? And then I'm going to go back through on TikTok and see if there's anybody who asked me questions. Again, I cannot see any comments on Facebook, so I know you guys are commenting. So I will come back and answer your questions on the Facebook. Okay, so frequently asked questions. This is U.S. only, so anybody in the United States could be on this plan. all the people that you add to your plan. If you do add people, they don't have to be in the same state. They could be wherever. If you're on vacation, you could still use your urgent care visits. Like if I'm in Florida, I'm just going to put in that I'm in Florida when I go to make my request for my consultation. So anywhere in the US. And the next question is, no, not every medication is covered. Lots of people ask that, is this medication covered? Is that there are some medications that are not covered yet on our prescription plan. Again, if you want to know which medication, if you have a certain medication that you want to look up, you will just need to go to that Facebook group and go to that portal that where you type the medication in, and it will let you know how, if it's covered and how much if it's going to be free or. I literally have someone who reached out to me yesterday who is on some special asthma medication, and it is covered, and it's literally, this program is literally saving her family over $500 a month. So she's paying $90 a month, and it's saving her, well, I guess by the time it's saving her family $400 every single month. Just, she doesn't even want, I mean, she gets to use the urgent care stuff, but she was more enrolling in this just for the prescription card, just for the prescription coverage. Okay. I already said there's no dental, vision, and there's no in-person visits. And then with a lot of people ask, can I pick my own primary care doctor? And the answer to that is absolutely yes, you can. So with the urgent care coverage, so like if today you signed up and you wanted to do the urgent care, you're just going to get whatever urgent care doctor is on call in your area. That you don't get to choose that part. But if you do choose the highest level program, the platinum program, you do get to choose your primary care doctor. So I'm very holistically minded. So what I did was I opened up the primary care portion. I started just going through the entire list, which was probably over 100 doctors in my area. And I just read their profiles. I made a list of the ones, like I am more inclined to go see a DO versus an MD. And I wanted somebody who talked about wellness and talked about preventative care. So in their bio. And so then I made a list of 3 or 4 names, and I haven't even had time to look at it yet. But now I'm going to go research those doctors to see which one I want to pick as my primary care doctor, because my husband is retiring next year and we are going to lose our insurance. And so that is one of the reasons why I personally wanted to get involved in this program, was so I could get my primary care taken care of, because we're just going to have a very like a catastrophic plan after that. Okay, I'm going to walk away for just a second. I am so sorry, but my robot vacuum has decided to infiltrate this room, and I have ADHD, and I would not have been able to ignore that. She was like bumping around. Okay. So anyway, okay. There is one caveat to this entire program, is that is I do not encourage, or I do not want anyone to wait to sign up for this program, because it does take about a week for your prescription coverage to kick in. So I found that out by whenever I did my visit on Saturday. I was able to immediately use my benefits and talk to that urgent care doctor, but my medications were not free that day. I had to use my insurance card to get them for, I think they were like $3 or something. It was a very inexpensive prescription, but you want to go ahead and get this activated as soon as possible, so that way your prescription coverage it kicks in just in case you do get sick. So that season is coming upon us. That season everybody's talking about, and they call it the flu season, which is total baloney. You know what the season is? The season is people eat more sugar, eat more crap, people get less sun, and people are exposed to everybody else who's getting all these things injected into them for the flu and pneumonia and RSV, or not RSV, the pertussis. They're getting all that stuff, and people are shedding all over the place. I said what I said. So it's very important that you get these systems in place. Again, go back to the very beginning of my video if you haven't watched it, and I talk about preventative health, because the very best medicine is prevention. So there are things you can do to support your immune system and get your body healthy to where you very rarely need to use an urgent care doctor. I mean, I'm just going to be honest. The primary reason I used the service last Saturday was to test it. It was just to test it. I go to the doctor maybe once ever, even though I have Lyme disease. I go to the doctor for sickness maybe once every 3 to 5 years because I know how to support my immune system. Okay, guys, so I am not seeing any questions here. Let me scroll through TikTok really fast. Again, if you want more information about this program, if you're on TikTok, you're going to click on that link, my little photo up there, and you're going to go to my profile, and you are going to either join the Facebook group or you're going to click on the link to learn more information about it. And then you are going to, if you're on Facebook, you're just going to type the word link or you're going to type the word group. Same thing on YouTube, and I will get that information to you, and on Instagram. All right. Let's see if I missed any questions. I don't think I did. So that was a little bit longer than I wanted it to be, but I wanted to make sure and cover everything. So thank you so much for watching. Again, if you're watching on Facebook, I will get back with you if you ask me questions. All right, guys, I think that's it. Thank you so much for watching. Bye-bye.